welcome all of you. I can't see you, but I see you are here. So really welcome to this very special panel, the English panel of fertility preservation and egg freezing, in conjunction with Puah, the Puah Institute, and Hadassah Hospital. And I really hope that this hour or so will be instrumental in, please God, letting you have one step forward towards fertility preservation and, please God, healthy children in the future. So I'd really like to start with introducing our team today. And this goes like this. Just a moment. Okay. So for tonight's panel, we'll start with a short recorded message from Rabbi Menachem Burstein, who is the head of the Puah Institute, well known and great on his own merit. We have Dr. Anat Hershko-Klement, who is the head of the IVF department in Hadassah Mount Scopus. She will speak for about 20 minutes and give us a medical, scientific understanding of the whole process of egg freezing and fertility preservation. I will discuss the rabbinic, halachic, hashkafic side of things and the experience we have here at the Puah Institute. Dr. Muriel Yarchi, she's the fertility preservation head of department at Puah. She will be speaking in Ivrit. Nevertheless, I understand most of you do understand, and there will be a clear slide that will explain what she is going to be saying, but it's important that you meet her. And we will end with a short panel with both Shalavit Simcha and Rabbi Frankel, which will share their experience, two brave young ladies who've undergone the procedure of egg freezing, and will share their experience and their knowledge and useful tips, I guess, that will make the process hopefully easier and nicer for all of us. So without any further ado, I'd like to start with Rav Menachem Burstein. And here he is.
Shalom וברכה לכולם. Hello, good evening. נדבר בעברית. בכל אופן, אני מאוד שמח שאתם משקיעים בלימוד הנושא של שימור פוריות, כי זה דבר מאוד משמעותי היום בעם ישראל. הקדוש ברוך הוא הקביל את הילודה עד גיל מסוים. יש לזה כמה הסברים, אבל מצד שני הוא הביא טכנולוגיה לשמר, וזה מאוד מאוד משמעותי. במיוחד בתחום הזה של הרווקות והפנויות, בגלל שהיה לי מאוד קשה לראות את ההתייחסות למי שעברה את גיל 35 ועוד לא התחתנה, והביא הקדוש ברוך הוא דרך טובה שאפשר במכת קור, זיגוג קוראים לזה בעברית, לשמר את הפוריות. והלכתי לרב מרדכי אליהו וביקשתי ממנו את הנושא הזה. אז הוא אמר אולי זה יביא להם שלווה. אז הוא אמר לי מה, שאלתי אותו הרב מה לעשות, אז הוא אמר לי תקפיא את ההצעה שלך. אחרי כמה זמן פתאום הגיע לרב איזו כתבה נוראית על נשים, בנות שיולדות ללא נישואים ובלי דמות אב, והוא שאל אותי מה אפשר לעשות, אמרתי לו, הרב, להפשיר את הרעיון שלי. וזה מה שהיום, ברוך השם, עשינו מבצע גדול, שכל רווקה שמגיעה לגיל 30 תקפיא ביציות, וזה גם עזר להתחתן. עשינו מבצעים גדולים, ולא תאמינו, מעל 60% מאלו שהקפיאו התחתנו מהר. זה כבר סגולה כזאת, קוראים לזה בעברית זיגוג. הזיגוג מביא לזיווג. כשהרב אליהו נפטר, פניתי לרב יעקב אריאל ולרב ליאור, וביקשתי מהם לבוא, כיוון שיותר מבוגר, לביתו של הרב ליכטנשטיין, ויחדיו, יחד עם רבני המכון, הוחלט שאנחנו מציעים לכל פנויה שהגיעה לגיל 30 להקפיא ביציות. ולכן גם עשינו ליווי מאוד מיוחד במכון לדברים האלו. גם השגנו הנחה גדולה בעשייה הזאת. אני עוד רוצה לשכנע שהמדינה, כמו שהיא מממנת לכל זוג 2 ילדים, שתממן גם את הנושא הזה, אבל זה ייקח זמן. בינתיים, בבקשה, תגידו, תשקיעו, שכל אחד באמת תקפיא ביציות. ועוד דבר, כשמתחתנים לא צריך מיד להשתמש בהם, קודם ללדת רגיל, ורק כשזה מגיע לגיל יותר בעייתי, אז אני מברך את רבני המכון ואת המחלקה לאנגלית ואת כל מי שעושה בנידון, שיסביר בצורה טובה וברורה, בשפה ברורה, את כל העניין הזה. ואני מברך גם אתכן וגם את אלו שמקפיאות, שהקדוש ברוך הוא ישלח לכם ברכה והצלחה בכל מה שאתם עושות, וימלא הקדוש ברוך הוא משאלות לבכם לטובה. ואני מוסיף את מה שהרב אליהו ביקש ממני תמיד להוסיף, ימלא לטובה כמו שהוא יודע מה טוב לכם. תודה רבה.
Okay, thank you, Rabbi Menachem Burstein. We will carry on from here to our next main key speaker, I guess. That would be Dr. Anat Hershko-Klement, the head of the IVF department in Hadassah Mount Scopus. A short but informative and interesting lecture. You can write questions at the chats or the Q&As, and we'll try, hopefully, answering those that we'll have time for. But Dr. Hershko, please.
So thank you. Just let me know if you can clearly see my screen and hear me.
From this end, it looks very good.
What?
From this end, it looks very good. So
okay, great.
You're on.
Okay. So good evening, everyone. It is a great pleasure to be with you tonight. And I would like to thank Puah Institute for the invitation, as well as to express my appreciation for this great initiative and for Puah's ongoing education, which I think is consistent, is wonderful, and is giving a great service to our communities. And let's start, because we have a challenge. We want to discuss fertility preservation in the next 20 minutes and give you all the information that I can share with you. So what we basically are going to talk about tonight is fertility preservation by choice. And I will later on differentiate it from medical situation when unfortunately fertility is at great risk due to medical conditions or medical treatments. So let's start with some very basic facts I would like to share with you, and I think will help you to better understand the process. So this is the anatomy of the female reproductive organs. As you can see, this is the cervix of the uterus, which is connected to the vagina. And this is the orifice to the uterine cavity, which harbors the pregnancy. So this is the entire uterus, and its neighboring organs are the ovaries, the center of the reproductive machinery, if you would like to call it this way. And the uterine cavity is, there is a kind of a road which leads to it, which is called the fallopian tube. And every month, one of the ovaries usually will get a mature egg that will be collected actively by the fallopian tube and will lead it towards the uterus. In case a fertilization happens, it happens somewhere here in the fallopian tube, and then the developing embryo around its the fifth day to its life will implant into uterine cavity. If this process will not happen, then all of the preparation of the uterine cavity will be lost, and the bleeding will come out through the vagina as the menstrual period. You can also see it here in a sagittal view to see the bladder, the neighboring the uterine cavity, and the fallopian tube and the ovary, which are usually in the normal physiology are all pelvic organs and not abdominal. Now, some basic facts regarding the ovaries, and this is quite unfortunate, but as Rabbi Burstein said, the Lord has his own reasons. We are actually, the female baby is born with 2 million eggs. We used to have more than this, but this was during our fetal life. When we were in our mother's wombs, we used to have more eggs, around 6 to 7 million of them. But by birth, there are only 1 to 2 million, and they are getting, we're losing them all the time. It doesn't matter if we don't menstruate, it doesn't matter if we're pregnant. There is a constant loss of eggs during the human female life. By adolescence, when what we call menarche, the age of menstruation, of getting a period, we only have 3,000 to 4,000 eggs. 4 of them will actually ovulating during our lives. And by the age of 50, there are less than 1,000 eggs. And basically, usually the menstrual cycle stops. The ovaries are obviously crucial. They are leading to the ability to get pregnant, but they're also secreting very important hormones, such as estrogen, which keep the bone health and have many, many other roles in our general physiology. So these were just very important facts. And not only the number is getting low through life, but also the quality. So an egg, an ovum of a young 24-year-old human female or young woman will not perform will perform much better than an egg of a 40-year-old woman. And how can we see it? We can see it by maximal fertility around the age of 24 and minimal rates of abortion, of miscarriages. While at the advanced age, more than 40 years, the fertility is extremely reduced. And unfortunately, the rate of miscarriage is going up, tremendously up. And this is because not only the number is getting lower, but also the ability of the egg to be fertilized and to lead to a normal pregnancy is greatly diminished. So this is the age effect. And how can we deal with it actually? What can we do? So we cannot bring things back. We cannot turn time back, okay? But we can freeze. We can freeze the situation in a certain point of time. And obviously the point of time is quite crucial, right? Because if we will do it after the age of 40, the performance of these eggs will not be so good. So the best option we can offer is to do it at a younger age, exactly like Rabbi Borstein mentioned. So this is called fertility preservation. As I said earlier, you can take it into the medical issues, which we will not do right now. And these are unfortunate situations like oncological situations, medication, certain genetic conditions that are bringing to a tremendously reduced fertility, a great reduction in the number of eggs and early menopause. And this will be cases when we will recommend to perform fertility preservation for medical reasons, and it will be covered in Israel. The other situation is social, when you're doing it because you choose to do it, not because of a medical condition. This is an elective procedure and it is not covered and you have to pay for it. So this is social, what is usually called social fertility preservation. And why has it become so common? Partly because women are postponing maternity in order to pursue a career or to get a higher level of education. And women are more aware, as Rabbi Borstein mentioned, to the fact that there is a great decline in fertility. And knowing that fertility treatments in the advanced age cannot overcome age and are involved with a very small success rate, women have the entire autonomy to take the decision to freeze their eggs at a young age, which will enable them peace of mind and knowing that if it will not happen spontaneously in the future, they have a certain control over time. So why is it feasible? Again, Rabbi Borstein gave a great introduction. It's been feasible and possible due to a revolutionary procedure in vitro fertilization, which is called vitrification. Though we know how to freeze embryo for at least 3 decades, the freezing technique was not that successful because embryos and especially eggs freezing procedure involved crystallization and a great damage to the cell and to its cell membrane. And vitrification, this flash freezing technique, was revolutionary. It enabled us to create tremendously good thawing rates and a great performance of both embryo and eggs. And we owe this technique our ability to offer such good pregnancy rates after thawing both embryos and eggs. So what would I like to shortly discuss with you? Some medical aspects, some emotional aspects, and some administrative aspects, all regarding social fertility preservation. So in Israel, currently, the legislation of the Ministry of Health limits the social fertility preservation to ages 30 to 41, to 4 cycles or 20 eggs frozen, whichever happens first. And you can utilize the eggs till the age of 54, sorry. So this is the current situation. It's been discussed. It will probably be changed, but this is what we're dealing with now. So it doesn't matter if you're 30 or 40, you're still due to maximum 4 cycles or 20 eggs. What are the principles of the treatment? So first of all, it's hyperstimulation, then is the actual egg aspiration, and then there is a freezing procedure. What do I mean by hyperstimulation? As we know, every month, the ovaries will mature only 1 egg. But we know that if we provide follicular stimulating hormone, we can recruit more eggs, those who were due to lost in this very month. So we're not turning our patient to run out of eggs because we are recruiting. We are just saving the eggs that will be lost anyway this month. And these eggs can actually be fertilized and lead to a healthy live born. So this is the controlled hyperstimulation. We do it when we control. We check ourselves to see that it's not too little or too much. And we control the ovulation. We use medications that will prevent premature ovulation. And then we performed a procedure called egg aspiration or ova aspiration. This is a timed procedure. We plan it ahead. It's almost always done through a vaginal procedure. And because the ovaries are neighbors to the vagina, and when they are getting large, all you have to do is just cross the vaginal wall. It's a few millimeters, and you're inside the ovaries. You can easily aspirate the eggs into a tube. They are immediately transferred to a microscope in the embryology lab, and later on, they are being vitrified. Obviously, not every egg that we retrieve is mature. Most of them are, and the mature will be frozen for at least 5 years. And obviously, there's no current limit to the freezing procedure, to the vitrification, but 5 years are covered by the initial payment. And later on, obviously, the patient or patients can choose to carry on with the freezing procedure. So is more the merrier. I don't have the time to go into the entire paper, but we know that no, not necessarily. So if we hyper stimulate and we're getting to extreme numbers, we know that we're not necessarily providing a better egg quality. So we're not aspirating for the maximal, necessarily for the maximal ability of the ovary. We usually like to keep ourselves in the range of 10, 15, 20, maximal 25 eggs. More than this might jeopardize their quality. So this is a very important point. Is it a safe procedure? Well, yes, I must say, if your general health is good, obviously any medical procedure involves a certain risk and certain complications, but these are luckily very rare in this kind of a procedure and in a basically healthy population. Hypercoagulability may happen, bleeding and infectious complications are extremely rare, so less than 0.1% will maybe be involved. There is the short-term ovarian hyperstimulation syndrome. We will not have a severe disease of this kind because we're not transferring embryos. So it's only a short-term one and usually self-limiting. And obviously we should acknowledge the limitation. Having an egg in the embryology lab does not equal a live baby, and everyone should keep it in mind. It's the best thing we can offer. We should also keep in mind that we can offer freezing embryos, but that's another issue. But this does not equal a live born. And we also should keep in mind that many women will never claim their frozen eggs. So in current papers, we know that around 12 to 15% of the women freezing their eggs will actually come back and claim them. And this is a great, great paper by the EV group in Spain, which gives us a very clear understanding of why the age where you choose to freeze your eggs is so crucial. And what they did is they split their population to above and under the age of 35. I will not go into the entire details, but what you can see here that if you choose to do it before the age of 35, which is the blue line, if you get your chances to fulfill the live birth out of these eggs till basically 100%. But unfortunately, if it's performed after the age of 35, of course, there is a chance to get a live birth, but the chances are much lower. So choosing the earlier age to do it provides you a much better chance in case you will need these eggs in the future. Obviously, the decision is not simple, and sometimes it is accompanied by unpleasant feelings of loneliness. It's not an easy way to take, and I think Puah is doing a great work in this term, giving and providing all the multidisciplinary team and the very, very supportive atmosphere, which is crucial. And I do want you all to remember that, as Rabbi Bushman said, I think the decision can also lead to a relief to a great hope and reassurance. And I also want to mention that especially in Hadassah Mount Scopus, and I'm sure that in Hadassah campus as well, emotional support is part of the treatment. So we definitely consider emotional support as part of the treatment for everyone, both patients going through fertility preservation and those obviously going through a fertilization process. So a bit of what I mentioned before about expectation, we all should keep in mind this is a rather new procedure. We don't have long-term data regarding the utilization of these eggs. We all should keep in mind the possible risks and acknowledge the limitations. But this is, of course, this is not like some people say, is it an insurance for, it's not an insurance, but it's as good as we can provide to an insurance these days. And our results are getting better and better. And obviously, as a fertility specialist, I'm supportive. I also always support my patients taking this decision again, but acknowledging the possible limitations. So I will end my talk with some administration. There are always pre-procedure tests that are obligatory. These will involve a blood count and serology test in order to make sure that the lab is a safe place to keep your very, very precious biological material. We need to see that the serology is negative for blood-borne viruses. And these are usually some of the tests that are mandatory wherever you choose to take this procedure in the world. There is obviously the cost because it is not covered. And you should always budget both the cycle and the medications. And once you've stepped through these two, you can get a one-step medical consultation and getting all the information that is personalized and can it be also predictive to your biology. We have the ability to do it. And you also have to budget usually for more than one cycle. We do advise patients to try and maximize their chances to the higher limit of 20 eggs. And usually most patients will need more than one cycle. So I'm happy to take questions either now or by the end of this wonderful evening. And these are my contact details at the IVF unit in Mount Scopus in case any of you wishes to ask or get more information. I'll be more than happy to provide it. So thank you.
Thank you, Dr. Hershko. What I think we'll do is maybe carry on. Maybe you should go through the Q&As that were posted. I took the liberty to answer the questions. So if you want to add or subtract or change or comment on things I've wrote, so you're more than welcome, but we'll do that maybe later on. So, so again, you can carry on answering the questions from now on. I will carry on. I will carry on maybe if you can. Oh, that's great. Okay. Here we go. So what I will try to give in the next 15 minutes or so is the Jewish / halachic / religious viewpoint on egg freezing fertility preservation. And again, thank you, Dr. Hershko, for a brilliant, clear presentation. I will pick up from there and comment, as I mentioned, on these aspects of things. So we'll start with the halacha. Clearly, there is no halachic prohibition. Anyone who would say otherwise will have to prove it. No one managed to do so far. So this does not breach any halachic problem whatsoever, not rabbinic, nor Torah prohibition. There's no question about that. More so, sometimes we don't have clear prohibitions, but there are halachic challenges or halachic problems. And here also, there are no real halachic problems. There are a few interesting challenges. There's social implications which may be related to egg freezing. And as I'll mention later on, we went to meet who was the chief rabbi of Israel. We saw him when he was the chief rabbi, currently as the chief rabbi of Yerushalayim, Rav Moshe Shlomo Amar. And he said, just like I wrote down, there's no halachic prohibition, therefore it's permissible. But he was concerned that if we advertise and try to convince women to go towards fertility preservation and egg freezing, maybe that will push off women from trying to get married, and therefore maybe don't publicize it as we were thinking to do. So he brought that as an option, but nevertheless, all the other halachic authorities and rabbinic leaders have agreed that that should be okay. A question we do get occasionally is what about the hymen? Because there, obviously, as Dr. Hershko mentioned, the retrieval will be transvaginal. So if that's the case, that will break the hymen, and therefore maybe a woman is not a betula, a virgin anymore, and some women are concerned. So first of all, halachically, it pretty much does not change the fact a woman is a virgin, whether she has the actual hymen or not, as long as she hasn't been with a man beforehand. So that's not really an issue. And it's true that in most procedures, it will have to break through the hymen. Nevertheless, there are some procedures. Dr. Weintraub in Hadassah Hospital and a little bit maybe in Shaare Zedek Yerushalayim would try and let you undergo the procedure without the tearing of the hymen. But nevertheless, as I mentioned, even if it does tear, it would not really implicate any halachic issues, and the woman is halachically still considered a betula. The ketubah will be written the same way exactly, and that not really is an issue. Maybe a woman should be, if the hymen is torn because she's undergone the procedure, that is something that should be revealed to the future husband, but nothing more than that. So again, halachically there's no problem, but is there any hashkafa issues that one has to deal with when we discuss these issues? So we know that there's a need to do the hishtadlut, to try things on our end, on our part, and just not just sit back and wait for HaKadosh Baruch Hu to do things on our behalf. Rav Menachem Borstein quotes time and again that we were born into the 21st century for a reason. And if God would want us not to have children, we would have been born 200 years ago, 100 years ago. We're born and living in this day and age, and we should be using the technology that HaKadosh Baruch Hu allowed us to accumulate and use and utilize. So that is clearly something we should be using. And again, one should take your own fate in their own hands and don't wait for others to do the job for you. And that's not replacing tefillah and not replacing asking tzaddikim to pray on your behalf and obviously trying to find a husband. But nevertheless, that is part of hishtadlut, and we have to try our attempts on our part. Working towards building the Jewish family. We do clearly believe, and that's a very Jewish concept, of building a Jewish family. And in order to build a Jewish family, which is a husband and wife and children, and to allow that to really happen for women who are reaching an age where fertility is jeopardized to an extent, so freezing eggs would allow you really to build a Jewish family. And therefore, it's not only something which is permissible, maybe it's something that is actually required from women who are reaching that age. There are some clear practical benefits of freezing your eggs. It reduces pressure. There's so much pressure involved of being single at over a certain age. Depends where and when you live, but it could be 25, it can be 27, it could be 31. But nevertheless, there's a pressure. There's personal pressure. Does that mean I'm not going to find anyone? And I'm doomed to be on my own for the rest of my lives? And there's familial pressure. It could be parents, it could be grandparents, it could be maybe friends. But anyone who's reached that age can pretty much identify with what I say. I have a sister who's older than all of you, I guess, and not married. So on a personal level, I know what she's gone through. And again, freezing your eggs will reduce pressure. And again, reducing pressure is always an important thing. And more importantly, it will increase your chance to get married, because men say it explicitly out loud that if a woman has her eggs frozen, so it would allow them to carry on with the shidduch, if it's a shidduch, or with the going ahead towards considering a marriage, because they know that they will have children. Their chances to have children are extremely high or different to a woman who did not. So that is something which is important on a personal level. And it's something that people should know. The prospective shidduch or the shadchanit or friends and family, those who are instrumental for us to get married or to meet people. So they should know that again, the time has stopped. The time is frozen if you've frozen your eggs, and that's really it puts you in a totally different place, personally and again communally. It's really a much better place to be in. And therefore, clearly, we highly recommend every 30-year-old single girl, single Jewish woman to freeze her eggs. 30, again, the laws in Israel, as we will hear soon, really speak about 30. If it's 29, it's also okay. Women who have compromised fertility should actually do it beforehand. But in a normal case, where 35 is the age, as we've seen by Dr. Hershko, that 35 is the age where the fertility is starting to decrease. So we want to have enough eggs, and the more the merrier, at the age of 30. So we would recommend, and that's really the most important take-home message for your souls and your friends, don't wait. One of the questions I was asked just before, should we wait maybe later on because we will have them frozen for longer? The answer is clearly no, and that was clearly indicated from what Dr. Hershko mentioned and the EV data that she brought. Don't wait. Do it as soon as you can. Just do it. Really don't wait. And again, the rabbis who endorse that will be Rav Amar from Yerushalayim, as I mentioned, Rav Yaakov Ariel, the previous chief rabbi from Undergone, Rav Osher Weiss from Yerushalayim, all three great halachic authorities, just three out of many who mentioned that. For those of you who know the American rabbanim, so Rabbi David Kahn, Rav Olbaum, Rav Shmuel First, Rav Eliad Brodny, Rav Reisman, again, the Haredi, the non-Haredi, the Sephardi, the Ashkenazi, really all great halachic authorities understand that this is something which is not only permissible, but even recommended. So again, it's medically feasible, it's doable, it's not dangerous. The chances to succeed later on are significant, and you can really almost only benefit from the procedure. What are the alternatives? And truth is, and Rav Wurstein maybe hinted to that when he spoke, there are two alternatives which are out there. The one is donor sperm insemination and conceiving as a single woman, which is something that at Puah we hold, and that's what we heard from the vast majority of halachic authorities that we have discussed the matter before. This is a real halachic challenge for various reasons. Again, we'd like all children to have both mother and father. And I know everyone's going to say, well, they're divorced couples and they're widowed couples, so how can you want every child? Some children don't have, and that's true, unfortunately. Nevertheless, creating someone who's from the outset without parents or without a parent is maybe something that one should reconsider. And more so, these children don't really have a father figure. Unlike a person whose father died before he was born, if that's the case, unfortunately, he grows on a father figure. He has someone who knows who's his father and his grandparents and his uncles and aunts on that side, and the legacy that he left behind, even though he may have never met him. But children who are born with no father figure, a donor, an unknown donor, that becomes a real issue. And again, the sanctity of the Jewish family is, as our sages teach us in the Talmud, there's Akadosh Baruch Hu Avi ve'imo, the Eibishter, the Lord, the father and mother who create a family. And again, that's the way we, at least the first hand, would prefer to see families. And more so, one should know that if one does take at least a Jewish donor, the child is in a very complicated halachic state. That child will be what is halachically called a shtuki, to the extent that there will definitely be dayanim and batei din who would not allow that child to marry. So at least taking a Jewish donor may imply a serious problem to those children, and may not be able to marry later on. So that's a serious issue, especially here in Israel, where there are very few donors and many hundreds of kids from those donors. So that's clearly not the way to go. And also, there's no real rush. I mean, even if you're 35 or 37 or 39, whatever the case may be, freeze your eggs. After you freeze your eggs, as I said, pressure is reduced, the tension is reduced, and you can rethink things differently, because time freezes as you freeze your eggs, at least in terms of fertility. So even if you really consider having the insemination, do it after you froze your eggs, and then reconsider it again, because as I said, there are halachic challenges and maybe other social challenges, maybe not the way to go. Dr. Hershko had alluded to that with a question mark about freezing embryos, and that's something that will be recommended by doctors in the medical centers, in the IVF centers, as an option. Truth is, we would highly recommend not to take that path for two main reasons. First of all, there's no real medical benefit by freezing embryos over eggs. Clearly, if you have 10 eggs frozen or 10 embryos frozen, you're so much better off with the embryos, because the chances for them to turn into healthy babies is several times over. Nevertheless, if you freeze 10 eggs and turn them today into embryos, or turn them in 2 years' time into embryos, there's a minor difference between the two, and therefore we would not recommend following that path, and mainly because that decreases your chances to get married or having more children of your own if you're married. So there will be places that recommend half frozen eggs and half frozen embryos. Half the eggs try and create embryos and freeze. Once again, these women who get married, and many of them get married, and again, those which were not claimed, maybe because they're not married yet, as the paper that Dr. Hershko mentioned. But that's something which we would, again, no normal man would want children of someone else. So if she has eggs, if his wife has frozen eggs, then they have a chance to have their own children. If she has embryos, he would not want to take someone else's children. So we would, again, as I said, not recommend freezing embryos, but rather freezing eggs. And again, call us. We're available, and we'll introduce Dr. Yarchi in just a second, but Dr. Yarchi is available. These are the phone numbers you'll hear, and I'll keep this slide later on as well. As you'll realize, Dr. Yarchi's English is not perfect yet. Her French is, but her English is not. And therefore, there is myself and Rabbi Weitzman of the English department. And if there's any extreme need to translate Hebrew into English or vice versa, so we're available as well. But really, Dr. Yarchi, under these phone numbers, is really the person you want to know. So feel free. All the information and all the support we'll be getting here. Therefore, without any further ado, we'll introduce Dr. Yarchi. As I said, Dr. Yarchi will be speaking in Ivrit, short 5 minutes. But again, the messages will all be on the screen which is right here. So Dr. Yarchi, you are welcome. And if there are any questions, I'll try to answer them maybe later on.
שלום, ערב טוב לכולם. קודם כל סליחה שאני מדברת עברית ולא אנגלית, אני מאוד מצטערת. אני מרכזת את התחום של שימור פוריות במכון. יש לי בערך בין 30 פניות לחודש. הבנות שפונות אליי הן בגיל יותר 34 עכשיו, לעומת לפני כמה שנים שהם היו יותר 38, אז ברוך השם יש יותר מודעות. אני חושבת שהתפקיד שלי במכון זה באמת שליחות ואחריות מאוד גדולה. אני מנסה לתת לכל אחד ואחד מענה בסבלנות, ברגישות, לתת מעטפת באמת מחבקת ואוהבת, כדי שהם ירגישו כזה תחושה של ביטחון. אני מנסה להסביר, למרות שאחריהם יראו גם את הרופאים, אבל כמו אמר דוקטור הרשקו, אני מסבירה כל שלב לשלב בתהליך, קודם כל מה עושים הבדיקות, בדיקות הורמונליות, גביעות, לקבוע תור למרכזי רפואי, פרוטוקול, זריקות, מעקב, שאיבה, זאת אומרת שכל הזמן אני בתהליך איתם כל הדרך, ובזכות זה באמת, בזכות הליווי הצמוד הזה, נוצר בינינו באמת קשר מאוד מאוד חזק ומאוד עמוק, אפילו אחרי סיום התהליך, יש לנו ממש קשר, למרות רוב הבנות אני לא מכירה אותם, לא פגשתי אותם פנים אל פנים, יש כמה שבאות, אבל הרוב אני לא פוגשת אותם פנים אל פנים, וחוץ מזה זה בנות שבדרך כלל מאוד סומכים עליי בתחום הרפואי, כי ידוע התחום הרפואי מאוד מאוד מתקדמת, ואני משתדלת גם להיות כאילו בעניינים וללמוד ולהתפתח יותר בנושא כדי באמת לתת מענה מקצועי ויותר. האמת שיש לנו שיתוף פעולה עם כמה מרכזי רפואי בארץ, גם צפון, מרכז, דרום, ואני יכול גם העיקר עם הדסה, ואני יכולה להגיד שלפני כמה חודשים פנו אליי תיירות שבאו מחוץ לארץ, מקנדה, אמריקה.
Yeah. Okay, I will mention something that Dr. Yarchi did not mention, and that is the cost. So it does mention here we have discounts, so managed, organized discounts in certain places, mainly two places. One is Hadassah, and that's why we have lots of cooperation and collaboration with Hadassah, Dr. Anat Hershko and others. But the prices we got from those places are somewhere around the 6,000 shekels for the procedure. 6,120, I think, to be accurate. But that's the price that we really have at those places. So we're very, which is again significantly cheaper than other places. And as she started saying, we managed to get these discounts even for tourists who are not yet Israeli citizens. So for those of you who are not yet citizens, that's an option as well. But really, Dr. Yarchi is so devoted to the fertility preservation and egg freezing, and she really takes every girl who calls hand in hand through the procedure and the process, and really it's something worthwhile getting advantage to know and see. So as I said, the first number, this number is the Machon's number, the Puah Institute number, and just ask to speak with Yarchi. And the second number is the cell number. She gets WhatsApp messages and calls. But this is something which is definitely worthwhile taking down and remembering. I think we will end this stage over here. And I would like to invite both Shalhavit Simcha and Rivi Frankel to join us. Hi, Shalhavit and Rivi. So again, as I mentioned before, both brave girls who've undergone the process and procedures beforehand, and both are willing to share their experience and knowledge. And I want to start with you, Shalavit. I know we would like to have longer, but we'll try to keep it in a relatively short period of time. But really, I would like to ask you, what is it that you wished you would have known before you've undergone your procedures, the egg freezing? And I know your story is even more special than the average case. If you can allude shortly about that as well, that will be nice as well. But so again, what really you would wish you have known in advance? I hope I'm not putting you on the spot, but that is yeah. So that would be one question, and maybe some tips that you've collected over the attempts you've done, because as you'll tell us, it was more than once that you've undergone this process. So please share with us your wisdom and stories. So we're all ears.
Okay, well, first I'll introduce myself and kind of give you like the background of why I chose to freeze my eggs. So my name is Shalavit Simcha. I'm 38 years old, and I'm a PhD researcher and a musician. I'm working with young people. We create music videos on mental health. I work in front of the Parliament in the UK, and I'm very passionate about my work. And I was engaged 3 times. I was more religious before. I'm less religious now. I do want to have a family. I'm committed to a family, and I've yet to create my family. And so I actually went through the procedure 4 times. And part of those was when I wanted to donate. I had a friend who wanted to have a baby, a Jewish baby, and we had the conversation, and I decided to go and help her. That was in the US. And so what I wish, and that was probably, I think, when you talk about like freezing your eggs, or in my case, it was also donating, it's like creating that possibility for human life that would not be there otherwise. And in my case, I've actually seen it happen, in the egg donation. There is a baby, and I'm kind of like an aunt, distant aunt that we had, but it just, for me, it's extremely moving to know that I could make that difference. In my case, it was with someone else, as well as creating that possibility for myself, and increasing that possibility. And that's why, and that's why I came from the conclusion of freezing my eggs, as well. And to be completely honest, it doesn't always work, but it creates that possibility more than it would. And yeah, for me, it's kind of like taking part of a miracle, if I'm able to. And I think finance is always the biggest thing for me. And, having faith and if you kind of see life as you're making your steps and what you can, and that's definitely something that you can do. And that's how I see it. And so that's me taking a step. I don't know what Hashem chooses for me, but I'm doing what I can. And what I wish I would have known, well, I wish I would have known, how it's not as certain. Because I remember, I did donate my eggs once, and it didn't work, and I remember the disappointment. So being really aware, and I think you guys did a great job of creating that. It doesn't promise, but it's taking a step, and it's creating more possibility. It's increasing your chance, and you're constantly doing an act to create your own family in the future. And I think when you change that, when you create that already in your perception, it's part of you creating a family. And I really believe in our actions actually make things change as we act. And tips and advice, It doesn't hurt. It really doesn't hurt. I'm one of the people who was so scared of needles. And the first time I did it, I always had someone else do the small injections. The needle is like this tiny. And literally, like when I give my blood, I need to look away and listen to music and think about unicorns. So I'm scared of needles. Those needles are so tiny. And in the later procedure, I was actually able to inject myself. You put some ice cube on your belly before, or they have these numbing creams they could give. It's really not that scary. So the process, the stimulation, it's about 10 days or so. I mean, twice a day. It's actually, it looks really scary at the beginning, but physically there's no real pain. And then the procedure, you get an IV and you fall asleep and then you wake up and then you feel like it was less than period pain, the pain that I felt after, for the next day when I got to have more ice cream. So the medical procedure is, it's scary because it's new and different, but it's relatively very safe. Of course, we get really scared, but I guess those are my tips. I guess the things that I would have been scared of before. There are a lot of logistics. There's the medications and making sure they take things on time, and you set alarms on your phone, and have a buddy that you keep accountability with to make sure that you it is an investment, and I believe in doing those things as part of taking action in life, because really action is what makes a difference in the future. You could, I do believe in praying, but the things I actually see change, prayer eventually makes you act. And I really believe in acting. So that's what I have to share. And I'm here for questions, obviously.
Thank you. Shalavit Simcha. That's, thank you for that. Maybe before questions, Ruvi, maybe on your side. Again, what are the things you think is important to know? Maybe encouragement you can give the 60-odd women which are here, and some of your experience, and again, your tips.
Yeah. So I think one of the important things for me being an Ola, I've been here since 2006, but I don't have any family here in Israel. And so making sure that I had a support system of people around me was really, really important. So I also did more than one round. I did 2 rounds. And the first time my best friend came with me. The second time I have like an adopted family. So the mom came with me. But beyond the medical, like needing somebody to take you home, people being aware, like I think that a lot of the people that ask me afterwards, like, were you embarrassed to tell people, and were you nervous to tell people? And I didn't necessarily tell everybody, especially with the second round. The first round I put a Facebook video out, so most people knew. But making sure that you have a support system here and what that looks like and talking about it was really, for me, very impactful. And yet the flip side of that for me, I think one of the questions you asked were like, what didn't you know or wish that you had known? And I did a lot of research, like a lot. I spoke to a lot of different people. And once I made the decision that I was going to do it and I started the process, I decided that I wasn't going to read any personal experiences because every single person's experience is going to be different. And while I was going through the process, I wanted to be in my own headspace. I didn't want to have expectations. I didn't want to hear about all the people that had successes or the people that it didn't work and give me stress and anxiety. I just wanted to be in the moment. And one of the things that I really loved about what Shalavit said, and I felt really differently, and I love the energy that she just kind of like that, like positive passion tefillah. I was really angry at God. Like I didn't expect to be, I'm 33. I started the process when I was 32. I didn't expect to be 32 and single. And coming to terms with the fact of not being in the place that I wanted with my family and thinking that I wanted a large family. And what does that mean when I'm 32? And why do I have to go through this process? And I think that that is also a really legitimate approach. Like, it doesn't feel fair. Like, why are we here? Why do we have to do this? Like, it's frustrating. And giving voice to that frustration for me was also helpful, and having something that I can do to at least, as everybody said, it's no guarantee, but to at least have that hishtadlut and like, here I am putting in my effort to try and do as much as I can to have a family, for me felt really powerful in that discussion that I was having with God. So that's one other thing. And then the last thing that I would say that for me was really important was making sure that I had space during the actual procedure. The first time I did it was over the summer. I'm an educator and a tour guide. It was Corona. There were no groups. There were no tourists. So I really had space to kind of do my own thing. The second time I was working, and I made sure to tell my boss that I was going through this process, because if I was very tired the whole time. The needles didn't bother me. It wasn't painful, the procedure, all of that. I was just tired a lot. And being able to say like, okay, I'm going to come in an hour late, or I'm going to leave a little bit early. And that flexibility of just giving myself space to be and to go through this process and realize how amazing a woman's body is and how amazing technology is that we can do this, for me was really important. I am really happy to take questions. I have a lot of random people that reach out to me on Facebook and other ways. I'm also part of a wonderful Facebook group about English-speaking fertility questions in Israel. But if anybody has any further questions, you guys are all welcome to be in touch just about technical experiences, or even if you're here without family and you want someone to come and hold your hand while you give yourself that first shot, whatever it is. I just give everybody a bracha that you find what you need to through this research process, if you go through the actual process, and that everybody should just see the good in what it is.
Thank you so much. I would like to maybe address one question that was asked, and please, Dr. Hershko, if you can help us with that. What's the age which, from there onwards, it's already of no use? In other words, until what age can we still freeze eggs?
Well, it's an excellent question. Currently, as I said, we're limited to a certain number of eggs and certain number of procedures, right? So if we would calculate, we can make the calculations according to an egg vitrified. If we wanted to provide a real chance for a live birth for a 40-year-old woman who comes over to freeze her eggs, we obviously need much more than 20, okay? Obviously, we need at least 40 eggs and maybe even more than that. If we cannot provide right now the ability to freeze 40 or more eggs, then this is not necessarily a real chance for a live birth. Now, let's say we had the ability financially to perform so many procedures. We would also have to ask the patient, we also have to estimate how many eggs we can retrieve at one procedure. So if the 40-year-old woman is a very good responder, her ovarian reserve is high, maybe we could get 10 eggs each time and get to this number. But if her ovarian response is low, as may happen in the age of 40, maybe we can only retrieve 4 to 5 eggs, and then we will need 8 procedures. And that's a lot to go through, a lot of money. And so it's a difficult decision to take. On the other hand, as my patients sometimes tell me, I understand perfectly what you say, but this is the best I can do right now. I realize my chances. I know my limitations. I do want to go through this because this is what I can do right now. And maybe, though I understand that the chances are very low, I still want to take this chance. And I think if it's an educated decision, then I totally support it. Okay, as long as we all understand the chances of thawing the eggs later on, knowing that they were frozen after the age of 40. So I hope I answered your question.
Thank you. Yes. So I'll maybe rephrase what you said. The earlier, the better. Okay. Definitely the earlier, the better. If you start 30, you're better off 30 than 31, and 31 better than 32, and so on. After the age of 35, we know there's a serious decrease in fertility, and it goes even further down after the age of 40. But this is the average statistics. There are women at the age of 41 and even 42 who are still fertile, and there are women at their 39s which are not fertile anymore. So, as you said, it's the best chance we have. Take it. Even if it's only 10% success, that's 10% more than not doing anything. So if you can afford one cycle, do one. If you can afford two, do two. So thank you. And that will definitely be our recommendation as well. And thank God, I mean, it wasn't too long ago, a lady who froze her eggs. She was 40 when she froze her eggs. She was single. She got married, and she conceived from the first time they've done IVF. They tried, the truth is they've tried naturally. She conceived and lost a pregnancy. And then they went on IVF from her frozen eggs, and she conceived and delivered a healthy baby girl, I think it was. That was maybe 6 months ago or 7 months ago. I don't remember exactly, but it works. It works. She was 40 when she froze her eggs. She was 41 when she got married. And again, it works. And there's nothing really better we can do at the moment.
Yeah.
I really highly recommend.
Mm-hmm. Yeah, we definitely get more and more experience. And as you said, it works. I see it like every month now.
Yeah, so that's great.
Yeah.
Any further questions that women want to bring up that were not probably answered? Can you space out the cycles? Is it good to space out, Dr. Hershko?
Sorry?
Spacing out the cycles. If a woman has to go 2 cycles, 3 cycles, what's the best thing? To go one after the other, or maybe to space them through a longer period of time?
So in medical terms, we don't mind doing them like in a row, okay? The only thing is that usually immediately in the period following a cycle, the ovary has not recovered yet, and there are many cysts which are functional. They are not dangerous in any way, and they are not, heavens forbid, cancerous, okay? They are just functional cysts created due to the hyperstimulation of the previous cycle. And these cysts sometimes press the healthy follicular tissue and prevents a healthy recruitment of the next cycle. So usually we would think it's better to wait 1 month to let the ovary recover and get to its initial size and no cysts around it, and then you can start all over. Obviously, if you're 32 and you wish to wait for 3 months, 3 months will not change your chances. So you can take a break, you can breathe, you can feel strong to do another one and then come back. So a few months will not interfere and damage your chances, okay? So usually I would advise patients, yes, to wait 1 month to recover, to feel better, and then come back. And it's also, as I said, it affects the chances to see that there are no functional cyst remnants from the previous cycle.
Thank you. We're pretty much out of time. But maybe last question, Shalavit Simcha, if it's okay with you. Since you've undergone the procedure in both Israel and overseas, how do you see the major difference between the 2 places? Or maybe it's exactly the same, or I mean, obviously it's much better here, is what you want to say?
So I've gone through the procedure first time in Mexico. I was scared and confused. second time was in California. That was for the donations. But yeah, so I've done that out of Israel and in Israel. I think Israel is small, and Machon Puah is, I don't know if people here know, but you're not charging for your service. I think it's kind of like, for some reason, like a secret that's not told. So
thank you.
So Machon Puah does their work as a contribution, and they give you, so usually the price in the hospitals is 7,500 shekels. And then you say, I came with Machon Puah, and they give you a discount for, I think, around 6,000 shekels. So I've got, Dr. Muriel for free with me on the phone and actually caring about me. And she's like, there are WhatsApp groups. And she's like, listen, if you can't pay for all the medications, there are other girls, like, if we could get some medications from other girls and swap them. It's like a family. Where outside of Israel, it's not that I was just a number. It really depends on what clinic you work with. Some of them are more personal. The private, more expensive ones, obviously, more personal. But Machon Puah these are people that really believe in what they're doing, and they don't charge for their service. They're helping you with a discount, and they're supporting you. So it's a completely different paradigm. I think in Mexico, I kind of felt maybe more like a number. In the US, I did have someone with me, but again, you don't really know them. And here I just call Muriel, and she really cares about me. She tells me I'm amazing, and she really supports me. And it's just a different experience. So it's like a family.
Thank you. Yeah, thank you. So I'd like to thank you all. I'd like to thank Dr. Anat Hershko for joining us, Shalavit Simcha and Rui Franco, Dr. Yarchi, and all of you ladies who've been here tonight. And again, please God, things will work out smoothly, easily, healthily, and hopefully very soon you'll have babies and children of your own, which is really what we're here for.
Amen.
So thank you very, very much. Again, call us, feel free. It is free. And hopefully we can help as much as we can.
Thank you all. And thank you for the cooperation. And as I said, I'll be more than happy to answer your other questions and inquiries through the email. So have a good evening, or a good night, actually.
Thank you so much, everyone. Toda, Dr. Hershko.
Bye.
Bye-bye.